Hello everyone, welcome to our YouTube channel Odontology, the study of teeth. Today we are going to talk briefly about halitosis. It is also termed as bad breath, breath malodor, foul breath or fetor odors. Let us discuss in detail. Halitosis is nothing but a subjective perception after smelling someone's breath. It can be pleasant, unpleasant or even disturbing if not repulsive. Moving on to the classification. It is classified based on etiology and patient criteria. Based on etiology, it may be local or systemic, and xerostomia also causes halitosis. Local and systemic factors includes two origins, that is pathologic and non-pathologic. Based on patient's criteria, it includes three types, that is genuine halitosis, pseudo-halitosis and halitophobia. Let us discuss each factor in detail. Moving on to the local factor under pathological origin, extensive caries, cysts and tumors, poor oral hygiene and periodontal problems also land up in increase in the number of microorganisms which results in halitosis. Under non-pathological origin, habits like smoking, danger and accumulation of food results in halitosis. Moving on to the systemic factor under pathological origin. Under pathological origin, you have diabetes mellitus, lung abscess, liver failure, tuberculosis and all will result in halitosis. Under non-pathological origin, having diet like which includes garlic, iron, alcohol and meat products will lead to halitosis because of the deposition of these things in the oral cavity. And other extraoral reason may be infection in the ear and nose areas. Moving on to the classification based on patient's criteria. It is divided into three types as I said earlier, genuine halitosis, pseudo-halitosis and halitophobia. Genuine halitosis is when the breath malodor really exists and it can be diagnosed organoleptically or by the measurement of the responsible components, that is called genuine halitosis. When an obvious breath malodor cannot be perceived but the patient is convinced that he or she suffers from it, this is called pseudo-halitosis. The halitophobia is nothing but a fear. If the patient still believes that there is a bad breath after treatment of genuine halitosis or pseudo-halitosis, one consider halitophobia, which is recognized by psychiatric condition. Moving on to the pathogenesis. Diet, microorganisms and desquamated epithelial cells results in undergo hydrolysis and results in formation of amino acids which further undergo degradation and forms volatile sulfur compounds containing methyl mercaptan and hydrogen sulfide. How will you diagnose that whether the patient is having halitosis or not? First of all, you need to take medical, dental and personal history. In personal history itself, you will be able to know whether the patient is having any habits like smoking or alcohol consumption. Moving on to the clinical examination. In clinical examination, you can examine intraorally and extraorally and ask the patient for self-examination also. Smelling a metallic or non-odorous plastic spoon after scraping the back of the tongue, evolving a toothpick after introducing into the dental areas, examining saliva spit in a small cup or a spoon, asking the patient to lick the wrist and allow it to dry for few minutes and ask him to smell it again to know the presence of halitosis. These are the self-examination methods we used. And after that you will go for an intraoral examination. You have to check the tongue for any tongue coating is present, mouth breathing, xerostomia and others. Complete periodontal examination should be done to evaluate the attachment loss by probing. Moving on to how to do the measurement of oral malodor. Advise patient not to eat, chew or smoke at least 3 hours before the procedures. Antibiotics should be stopped at least 2 weeks before the procedure should be done, because the presence of these may land up in arbitrary results. Next, organoleptic odor rating method. In this, the examiner will stand in front of the person who is having halitosis and ask him to close his mouth for at least 1 or 2 minutes. Then ask the patient to hold his breath for 15 seconds and after that ask the patient to open his mouth widely. so that the examiner can give a subjective scoring. This is a golden standard method for rating the oral malodor. If he gives 1 means absence of odor, 2 questionable to slight odor is present, 3 indicates moderate odor, 4 indicates strong malodor but the examiner can tolerate, 5 is severe, overwhelming, examiner can't even tolerate the halitosis. Next, gas chromatography is a machine which measures molecular level of sulfur compounds. It is also one of the method of measuring halitosis. Then moves to the halimeter. The main disadvantage of this method is the mercaptan levels are not easily recorded, very sensitive to alcohol. So avoid alcohol at least 12 hours prior to the test. Moving on to other tests like chemiluminescence, diamond probe, Barnard test, dark field or phase contrast microscopy, saliva intubation, electronic nose are some of the other tests to identify the halitosis. In chemiluminescence, it has mercury, the sulfur volatile sulfur compounds joins with the mercury to form a fluorescence. It is highly sensitive because even a very small amount of sulfur will result in the positive indication. Barnard test also same thing, when the sample is placed means it will undergo breakdown and gives the color change that indicates positive test. Diamond probe is a probe in which the tip contains sulfur sensor which identifies the volatile sulfur granules in the oral cavity. It helps to identify the presence of halitosis in the oral cavity. Then moving on to the management aspect. How will you treat this patient? You have to give step-by-step solution to the halitosis patient. First of all, you have to identify the source of malodor. Then mechanical and chemical reduction of microbes should be done. Rendering malodorous gases non-volatile. Masking the malodorous substance. Mechanical reduction of microbes includes tongue cleaning for the presence of tongue coating, toothbrushes, periodontal therapy which includes scaling and root planing along with mouth rinse. Chemical reduction includes chlorhexidine, CPC, essential oils, chlorine dioxide, hydrogen peroxide and triclosan. Next, to render the malodorous gases non-volatile, metallic salt solution contains zinc, toothpaste, chewing gums are used. Masking the malodor can be done using rinses, mouth sprays and lozenges. To conclude, oral halitosis has important socio-economic consequences and also reveal important disease. A proper diagnosis and determination of the cause allow initiation of proper management. So these are my reference. Thanks for watching. Hope you like this video. Please subscribe and click the thumbs up.